This is Brent of the Brookbush Institute, and in this video we're going to go over more vibration or percussive release techniques, this time for the adductor complex. I'm going to have my friend Yvette come out. She's going to help me demonstrate. Now I'm going to have Yvette in supine, and if you've seen our adductor magnus stretch or our adductor magnus static manual release videos, you'll kind of be familiar with the position that's easiest to use this tool in, which is I'm going to go ahead and have Yvette kind of flex and abduct, and then she's going to take her foot and put it right down on my ASIS. Now I have good control over how much tension is in her adductor magnus, and I could even kind of control this a little bit if I needed to. I could put a towel under here if I wanted to control how much tension maybe is in her anterior adductors. Now if you guys are a little unfamiliar with where the hamstrings stop and where the adductors start, a quick tip which I'll go over more in the close-up recap: if you put one hand like this over that whole kind of inner thigh and posterior thigh area, and then have Yvette go ahead and kick your heel towards that leg, good, and I can feel her hamstring tendons pop into my hand, and then I could go, okay, relax, now go knee towards the ceiling, good, now I can feel her adductors get real tense as they contract, okay, let's do that a couple more times, good, heel, good, knee up, good, and I can actually start to not only feel but visualize the line that separates her adductors from her hamstrings. All right, so now I'm going to go ahead and kind of slowly go over this entire adductor complex with our release tool. Now, as I've said in other videos, a little counterintuitive. We start at the higher settings and then work our way down as we go deeper. You do have to be really careful with the inner thigh because people tend to be really ticklish when you start. So you want to be firm, but you're going to have to give them a couple seconds to desensitize. Eventually they will desensitize and you'll be able to go through the technique no problem, but like the first couple passes, you can see Yvette here giggling a little bit. First couple passes are a little rough, and then usually they'll go, okay. Right? You good? See, just takes a couple seconds, be patient. You probably just kind of want to hold it in one spot for a couple seconds and let them desensitize. I have noticed that the round tool in this area, so you guys have to see the round foam end, works a little bit better for anti-tickling than that flat piece, which you guys know I prefer for most other techniques. All right, so we'll turn this back up. I'm just going to go ahead and trace the entire adductor region, nice and slow, really trying to get the tissue to kind of melt under the tool here. And of course, I'm going to notice anything that gives me like some kickback. Maybe notice anything that I get a twitch response in, which is where you can see the fascicles kind of jump underneath the tool. All right, I'm just going to kind of go over the whole thing. Every once in a while you do hit a ticklish spot. And as I'm going through, I'm making mental note of the trigger points I hit. Now most trigger points, guys, for the adductors are going to either be very close to the hip or they're going to be very close to the knee. You don't tend to get as many trigger points in the middle. Now of course, if I'm doing this technique, it's important that we're doing it for good reason. Like I don't just use a cool tool to do some cool modality just because it's cool. If I've done this, it's probably because I think Yvette has either an overactive adductor magnus or overactive anterior adductors, and then maybe I would stay kind of to that superior medial portion of her thigh. Maybe she had like knees bow in, right? Which we know that knees bow in, adductor activity is higher. We know that like for an asymmetrical weight shift, piriformis issues, adductor magnus is often involved via its attachment to the sacrotuberous ligament. The point being is you guys are doing this based on assessment. You're doing the technique to be effective, right, to get a result, and you want to see change in that assessment. That's also important for professional reasons. Obviously, if you guys are releasing somebody's inner thigh, this is a sensitive area. You want to make sure you are very clear on your rationale for your patients. Now, once I've gone over this whole area, right, and we can see that this is like not only a ticklish area, but it's also a very dense tissue area. Right? Once I've gone over the entire area and we've gotten some desensitization, it's calmed down a little bit, this is when I go back over with this smaller tool, right? So now I'm going to go over with the bullet just those couple of dense areas I found to release those deeper trigger points. Right, and there was only 2 with the vet here. We had one here in the knee, and be careful here so I don't totally jack up her tickle response. Right, and I'm just going to slowly guide my way through that area. And then we have the same thing here. Right, deep in like more of like the origin of the adductor magnus tends to be very tender. Now the one other position I'll use for adductors, although this is probably better for like the anterior adductors, is I'll have somebody in side lying. So let me have you face the wall. She's going to take her top leg and just put her knee down like this. Now if I want to put more tension in my anterior adductors, I could pull her back into more extension. Now her whole adductor area is very easily accessed. Right? And I can go over and do the same thing. Now the downside of this technique is I don't have much control over how much tension. Other than moving her leg into extension to start off, I don't really have the same control I had in that other adductor magnus sort of position. How's that feel a bit? I can tell you that people who have no tolerance for the other technique sometimes have a much easier time adjusting to this particular position. Right, this one tends to not bring on that huge tickle response. Right. You can see if that's fine with this technique. I think I've mentioned before, guys, the vibration percussive therapy actually works better over close. All right, so if some of you guys are wondering, like I know my manual therapists, like usually we like to be on skin because we get a little bit more tactile cue back, right? And especially if you're doing like any pin and stretch or fascial techniques. But with this particular tool, because of the moisture in your skin, it'll get caught. It's a lot easier to do this over clothes. And with this particular foam piece that comes with the Hypervolt, it's a lot better to do it over clothes because the foam is a little rough. So if you get sideways, you can kind of give somebody a little bit of a burn. Like the rough surface like will produce enough friction to give somebody a little like almost like a rug burn sort of feeling. Great. All right, guys, stay put for the close-up recap. So I wanted to quickly go through this technique with you guys on the close-up recap, show you that technique of differentiating between the adductors and the hamstrings. So if I take one hand like this and just kind of place it over the area that I know the adductors and hamstrings exist, I can then have a vet go back and forth between flexing her knee by pulling her heel in, right? And I can feel her adductor or hamstring tendons right there. And then if she goes leg up into my hand, I can feel her adductors get tense right here. Right, and I can have her do that as many times as I need her to. So like, let's have you just pull in your heel. Oh, there we go, good. Really push into my hand, cool. Yeah, I can feel those tendons right there. Good, and then go ahead and push up against my hand, good. I can feel her adductors right there. And what I'm trying to do is kind of establish, where am I going to kind of strafe over with this tool, right? So we had talked about how the round piece works a little bit better in this case, seems to be a little less ticklish than that flat piece. I'm going to start on my higher settings. I'm going to give her a second to acclimate, try to keep her from guarding on me and being super ticklish. And then I'm just going to go along the whole area that I felt tense up when I did that little adductor test. Right? People get a little tender over those adductor tendons, guys, so be careful. Don't press in. If you're using this foam piece, it's probably better to do it over clothes, or if somebody was wearing shorts, maybe you throw a towel over their leg. Got a little bit of a twitch response there, right? You guys saw that. So maybe that's something I want to go back over, right? A little trigger point. She definitely has much more tissue density in this area. which I mentioned to you guys is very common. Like adductor trigger points tend to be close to the knee or closer to the groin. They generally don't fall in this middle area here. So now I'm going to grab that smaller tool and I'm just going to slowly kind of work out that area where we had increased tissue density at a lower setting. So I was on 3 just now, now I'm on 1, and I'm going to try to get a little deeper in this denser tissue area. So there you guys have it, adductor release using the hypervolt. I hope you enjoyed the video. Please leave your questions and comments in the box below.